Professor Jean Feeder gave the Helen Lester Memorial Lecture on domestic violence and childhood adverse experience.
Domestic violence is important because it underpins many of the common presentations we have as GPs. In other words, many problems, many mental health problems, chronic conditions, unexplained symptoms, some of those patients will have domestic violence in their background. So a key reason for not ignoring it is we can't be good clinicians if we don't understand that the symptoms in front of us may be affected by a previous history of abuse.
So what should GPs do?
So our recommendation is first get some training, which is tough in some necks of the wood, training in how to ask and how to respond. And then there's this crucial aspect of finding a link, hopefully a local link, to an organization or an agency, it's usually a third sector organization, that gives support to survivors of domestic violence, so that gives advocacy. Because once you have a link to that, then in a sense, asking, getting a disclosure doesn't mean it's all on your shoulders anymore, any more than if you diagnose a complex arrhythmia in a patient, you know there's a cardiologist that you can refer to. So that's, I think, pretty crucial. I think the other thing is that's important is to be able to, within a practice, communicate about some of these patients. These are often difficult patients. It may be traumatic for you to engage with them, so there should be a sort of practice level policy or approach, the same way there is for child maltreatment. So we think it should become something that's discussed at clinical meetings.